got a health watch right now. We know that sugary foods are bad for your teeth, right? But the medicines you take to help you get better could actually be hurting your teeth and oral health as well. Joining us this morning, Dr. Brett Zach. He's with us to talk more about this. Doc, good to see you. Thanks for coming in today.
Thanks for having me, John.
Okay, let's first of all talk about the medicines that can damage your teeth. We've heard this before. Which ones in particular are you talking about here?
Well, I think it's important to point out first that there are over 400 prescription drugs that can damage your teeth. It's estimated in
400.
studies. Absolutely. It's estimated that that over 40% of the population will take a prescription drug that can harm their teeth. The most common ones we see in our practice are antihistamines, antidepressants, and to a large extent, blood pressure medications.
Okay, you just stimulated a question here for me then. Okay, if it's prescription drugs, some of those are over the counter as well.
Correct.
Same situation?
Correct, same thing. Yes, there are several over-the-counter medications that can cause the same dry mouth issues.
All right, let's talk about who you see it in the most. I assume the longer you're on these drugs, the worse it gets. So elderly people?
Yeah, absolutely. And I think it's a combination of the fact that elderly people take the most medications, as well as the fact that elderly people have the least care. A lot of times elderly people are in facilities where they're not looked at as much as they should be, and that's when their oral health will deteriorate beyond that of somebody who may go to the dentist every 6 months or so.
For a lot of people, especially kids here in Central Florida, they're on all types of antihistamines, especially because of allergies.
Sure.
They could be doing some damage early on, though, for these kids.
Absolutely. I think it's important that if you see the dentist every 6 months, they can recognize early signs of incipient or beginning decay, and they can tell you what needs to be done.
But that's a great point. If you see it in a 9, 10, 11, 13-year-old kid,
sure,
you see a little decay, I wouldn't imagine you would think, well, this is drugs. You'd probably think it's bad food, right? How do you make sure you know what's causing the problem here?
It's one of those things that you never know exactly for sure. When I see a patient, I'll tell them, are you brushing your teeth? Are you flossing your teeth?
They're always going to tell you
They're
yes.
always going to tell you yes, of course, especially the flossing question. With children, usually that's one of the least things we look at is which drugs you're going to take. With elderly patients, there usually is a laundry list of prescription drugs they might be taking. They might be taking 5, 6, 7, 8 drugs that are all compounding. So it's more the compounding effect that causes the issues.
Well, and then you're in a difficult situation. You need these drugs to maybe keep you alive in some cases or make you feel normal when it comes to allergies.
Sure.
What do you sacrifice here? Feeling good all day or tooth decay?
Well,
how do you balance that?
I think it's also important to point out that these drugs are doing their job, okay? And the last thing you want to do is stop taking these drugs because you might start developing dry mouth or decay issues. So I think it's important that you talk to your MD, okay? There are several different things that can be done. The first thing is the MD might be able to recommend something that has the same effect without the negative side effect of dry mouth symptoms. Another thing is that we always tell our patients, elderly specifically, to chew sugar-free gum and to drink water frequently.
Really?
Absolutely.
Now, you've said dry mouth numerous times.
Sure.
Is that the first sign
And
wrong?
that's the biggest reason and the biggest sign that one of the side effects prescription drugs can have is they can decrease the salivary flow inside the mouth. The saliva is the body's natural mouth rinse, if you will.
Had no idea. Good stuff. Dr. Brett Zach, good to see you. Hey, you got a website in case people want to check you out?
We sure do. It's nlcdentistry.com.
All right, sounds good. Thank you very much.